Big Pharma is coming to Montreal. At the end of April, Moderna confirmed a new production facility will open in Montreal. Prime Minister Justin Trudeau said that this will make Canada a leader in mRNA.
And Canada, that has long been leaders in research around mRNA, will now be also leaders in delivering mRNA to Canadians and to the world with this investment.
Moderna coming to Montreal will secure long-term Canadian-made vaccines, as well as secure hundreds of jobs for Montrealers. Once the facility is open, 100 million mRNA vaccines can be produced annually. But is there a downside to this? Securing more jobs and long-term access to vaccines are essential. However, Canada is still allowing for patents to continue on COVID-19 vaccines. This prevents developing countries from producing and distributing vaccines to all of their population. Burundi, Congo, Haiti, and Yemen have the lowest vaccination rates in the world, with less than 1% of Burundi and around 2% of Yemen having received at least one dose. In this episode, we'll look into how capitalism prevents global access to vaccines. But first, let's look into pharmaceutical companies.
I'm nervous about, particularly with how we're doing our sort of local biomanufacturing policies, and specific to Montreal, how we're allowing Moderna and Novavax to exploit/use government resources to develop and scale out products for their private interests without necessarily responding to the public health needs of the time. Right now, what we'll say is, Moderna, you do what you want, and we'll buy those products off of you when those products become available, whatever those products may be. And so without a public health-driven agenda for these companies, it becomes sort of, we're sort of chasing the companies along the way.
Moderna started off as a small company based in Massachusetts, but accumulated billions, becoming one of the first companies to complete the mRNA COVID vaccines for clinical trials.
Moderna was publicly funded to a large part. A lot of this research came from publicly funded research for the COVID-19 vaccines. And so it's really disappointing to see now profits taking over the research for the mRNA vaccine, the research for that has been going on for years before COVID-19. That was all at publicly funded institutions. Those scientists, have full-time jobs where this is what they're looking into, because you can't guarantee a profit in this area. It's more likely that the public sector is going to have an interest in doing that research.
Patents are what limits access to vaccines for all countries. This means the companies who have patented their vaccines are the only company that's able to produce them.
Regions, countries need to be somewhat autonomous and somewhat able to respond to their public health needs and not dependent on the whims or the availabilities of places around the world. And so if there's an outbreak of something in sub-Saharan Africa tomorrow that would be beneficial from an mRNA type vaccine, they wouldn't be able to respond in as quick a way as they would need, and would have to wait for foreign interests to be interested enough to develop a product accordingly.
Patents do not only affect the vaccines. Italy faced the threat of a lawsuit as a result of 3D printing an expensive and patented medical valve used in ventilators at the beginning of the pandemic. The Trade Justice Network has been pushing the federal government to end patents for the last year.
Canada, originally the US, and the EU have been dragging their feet on agreeing to make this happen. The Canadian government and the American government and the EU are being very heavily lobbied by pharma. So I think it was at first not wanting to upset these big companies when we needed to get some ourselves, because Canada is in a unique situation where we're not really producing anything in the supply chain for these vaccines. So we don't really have anything to bargain with. And so, the Pfizer and Moderna could have said, we're not going to give you any. You're going to go to the bottom of the list if you take this position. But it's also, they just are very powerful in terms of, and influential in terms of their lobbying.
Without widespread access to vaccines, we can keep being infected, as travel has played a role in the introduction of new variants.
I hope global leaders who have shown such resolve in protecting their own populations will extend that resolve to make sure that the whole world, is safe and protected. And this pandemic will not end until we do that. The highly effective tools science has given us need to be shared fairly and quickly with all countries of the world. Vaccine inequity and health inequity overall were the biggest failures of last year.
So what's the process of developing a vaccine? It relies on a mix of publicly funded universities, pharmaceutical labs, and for-profit pharmaceutical giants to get it out of the lab and into trial, approval, and rollout to the public. There's been a push for a people's vaccine, meaning a publicly owned vaccine.
When you use the word public vaccines, you could probably say all of them. And I say that because public means that there's been some dedication of public resources towards the development of those vaccines. And the way science works is that it's not just out of nowhere these things emerged. It's been decades and decades of slow, laborious basic science to figure out that this is the vaccine that would work in this time. And so if you look at, say, the mRNA vaccines, they've been being worked on from the public funding perspective. In Canada, CIHR, which is our public funder. In the United States, the NIH, which is their public research funder, over 30 years has spent money on the foundational work to develop these vaccines. Then over the past, say, few years, that public money has then just been usurped, but for private interests, where those products were developed in public spaces then get pushed towards the private space for development and ongoing recoupment of costs.
If the vaccine is truly a public good, if it's, the research and the funding and the manufacturing is publicly owned, then you don't have that problem where profits get in the way of making sure that everybody has access to the vaccine.
Are there any public vaccines out there?
If you look around the world, most of the vaccines have similar frameworks whereby all their foundational work is done in public labs. Some of them have more public infrastructure attached to their development. Say, if you look at the Cuban vaccine, if you look at the Chinese vaccine, all of those were more publicly developed and sold, not just their foundational science work. If you look at the Cuban vaccine, their vaccine, which was developed at public labs and tested through their social health care system and is owned by their government, is a true public vaccine, and it's owned by their people. And they're sharing the ability to manufacture that vaccine with people around the world and companies around the world and governments around the world who want to be able to make it. That being said, in Canada, that system is not really in place. And so our public labs and, say, our National Microbiology Laboratory, which is in Winnipeg, developed and did a lot of the work of the Ebola vaccine, which is being used in Congo right now. They have an outbreak. But they weren't able to push it across a finish line for development and testing and so on until they were able to get private industry to do it.
Canada's pharmaceutical sector wasn't always privately run.
Canada had a system for this up until the mid-70s. If you look into the history of the Connaught Labs, which is a lab in the University of Toronto that was developed back in the 20s, back when insulin was discovered, it was seen as not really a sustainable model because of private industry taking over that sector. And the funding was lost, but more so policies weren't in place to ensure that it had the sustainability and infrastructure to continue.
The 1st of May marked International Workers' Day, as many Montrealers took to the streets, an annual occurrence, to push for workers' rights. Montreal nurses called for international access to the vaccine and denounced Justin Trudeau limiting global access to patented vaccines.
Canada in particular has been a bit of a vaccine villain. The developing world has taken all the doses, and the ones that are left are very expensive. The ones that are given are often close to expiry. and so they're not actually very useful. It's time to share the science with the rest of the world. His Minister of Innovation behind the scenes has been blocking the legal mechanisms that would allow for developing countries to produce their own vaccines.
We're going to invent the future of vaccines in Canada. Obviously, if Moderna is going to be manufacturing vaccines in Canada, Canadians will be first in line.
Some Canadians are preparing for their fourth dose, while only 15.7% of people in low-income countries have received at least one dose. This highlights inequality in our society. Many rich nations have high vaccination rates, while many poor countries do not. So say you're not concerned with infection rates of another country across the world. You should be, as this can still infect you. Since we're such a global community, outbreaks that occur in places across the world can infect travelers entering Canada, thus infecting our population. Let's look at the Omicron variant BA.2, for example. This variant started becoming dominant in Europe in early March. By mid-March, BA.2 accounted for half of all COVID cases in Canada. The wealth inequality isn't only apparent country to country, but neighborhood to neighborhood. Early on in the pandemic, data showed how Montreal's poorest and most racially diverse neighborhoods were being hit the hardest by COVID-19. In Montreal North, from the start of the pandemic to June 2020, 222 people died from COVID-19. More deaths occurred in this neighborhood than all of British Columbia during the same time period.
The world is not treating the human race same way. Some are more equal than others. The greatest threat we face now is not the virus itself. Rather, it's the lack of leadership and solidarity at the global and national levels. And we cannot defeat this pandemic as a divided world. The virus thrives on division, but is thwarted when we unite.
So how can we access a public vaccine and facilitate equal access to vaccines?
In healthcare, we always speak for system design, and the famous quote is, every system is perfectly designed to get the results that it achieves. And so the results that we've achieved in our system, it's exactly what we should expect, namely that these companies that are responsive to private interests would serve those private interests. What regular Canadians can do is sort of think about what system would be better at producing a system that responds to public interests. And those systems are different than our current sort of private sector-led processes, and sort of have a more robust public approach to tools of public health goods. Having like these public sector-driven protocols whereby we own collectively these goods, and this is a good that's necessary for public well-being, like roads and lighthouses and other things like that. We need to make sure that we have control of those things and can deliver them appropriately. And so, in sum, what can regular Canadians do? Overthrow capitalism.
Are you happy with Canada's first vaccine facility opening in Montreal? What do you think about patents preventing many countries from vaccinating their population? Let us know below in the comments.